Hello and welcome. My name is Jamie Gillespie. I am an MSN student in Nursing Informatics at Rasmussen University, and I am here today to talk to you about my Quality Improvement Initiative. On the agenda for today, I will first discuss the background and significance of my identified problem, synthesize both internal and external evidence, and make a recommendation of an innovative technological solution for the identified problem. Background and significance of the problem. First off, is this a process problem, a program problem, or a system problem? I'm going to talk today about the process of documentation during trauma codes, really any critical situation, but particularly our trauma code, since we are a level 1 trauma center. One of the main focus and goals on the level 1 trauma center is excellent charting and trauma documentation. Our current process of electronic documentation can be really time-consuming, reported by our nurses. It can be perceived as increasing workload and interfering with patient care. Nurses describe this process as cumbersome. It requires clicking into several different tabs. Our required documentation are often missed, particularly our initial assessment, reassessments, our repeat GCSs, and full set of vital signs on disposition, especially that temperature, can really get forgotten about. Not only can poor trauma documentation affect our patient outcomes, but it also threatens our trauma accreditation as well. A main reason that this is a problem within our hospital is that nurses really just deprioritize our documentation and charting. Documentation electronically interrupts their duties, increases their workload, consumes too much time, and takes away from patient care. Our hospital has attempted to complete these trauma charting on paper for completeness, but the issues we have is they get lost or soiled, and it's also a HIPAA concern is if they get misplaced as well. We also want to avoid anything handwritten just because of poor penmanship, especially when we're in a hurry. There can really be a lot of miscommunications if something isn't written clearly. So let's look at some of the evidence we have. First off, internal evidence from within our hospital is that only about 75% of our trauma codes are doctored completely and accurately. Like I mentioned before, the frequent tab switching results in lots of time and reduced accuracy. Nurses have to switch between the vital signs flow sheets, the medication administration, the assessment flow sheet, and this can really be very cumbersome and time-consuming trying to find all of your information rather than having everything all on one page. Also of note, what we see within our hospital is also really reflected on outside hospitals as well. We look at external evidence and peer-reviewed literature, and many clinicians really struggle with that balance between documentation and patient care. Delayed, incomplete, or inaccurate documentations risk our patient safety and our ability to provide this high-quality care. It can also be legal ramifications, regulatory compliance for poor documentation. It's also shown that delayed documentation can really feed into inaccuracies as well. Most electronic charting systems are not particularly easy to navigate, especially in very time-critical situations where you're trying to chart in real time and take care of patients at the same time. The overall consensus in the peer-reviewed literature is that our documentation should be complete and accurate in order to deliver safe and effective care while still achieving regulatory and legal compliance. Electronic flow sheets must be designed with the end user in mind and being able to streamline charting and patient care and decrease the overall work burden, not increase it. Which leads me into my technological solution for this problem, electronic flow sheets. Now, this is a special narrator within Epic, We can select for our trauma codes where all of our required documentation is on the same page. All our medications, reassessments, interventions, and evaluations are all on the same page, where we can chart our procedures as well, including our lines, our tubes, our airways. Everything is all on one page without having to flip between tabs. Another nice aspect of this particular electronic flow sheet is that when your required documentation is completed, it is checked off. So if you are missing something, it tells you it is right there that it is missing. So nurses don't actually have to hunt to make sure that everything's covered. And our ultimate goal for incorporating these electronic flow sheets is that to ensure timely, accurate, and complete charting on trauma patients. Since real-time charting is so crucial in accurate documentation, better care coordination, less errors, and improved patient outcomes, we really need to make sure that this is a very user-friendly program and promotes a smooth workflow. This truly is a better solution than paper charting because we talked about penmanship, soilage, they get misplaced as well. The electronic flow sheet goes straight into the EHR and is available for the next phase of care as well. And we do have many studies we talked about in our evidence that these electronic flow sheets increase documentation completion compared to paper charting, and overall satisfaction rates are quite high. This electronic flow sheet ensures that all the requirement documentation with visual checkoffs and that feedback. If it's not charted, it's in red, and as soon as you chart it, you get a little green check mark. Users can see instantly that their charting is complete or lacking and not have to waste time trying to find what they need. The solution will impact our quality improvement. Implementing of the electronic flow sheet will increase our speed, accuracy, and completion of documentation. It's important that our team to ensure that flow sheets are user-friendly, assist in the workflow, and minimize disruptions. Our staff will have to obviously receive adequate training for the smooth transition, but once implemented, this trauma flow sheet will safeguard all the required charting, and these frequently missed aspects of our trauma charting should now continue to be complete and accurate. And this is going to also improve our handoffs and in transitions of care between units. And overall, hospitals do find lots of success and satisfaction with these programs. Thank you so much for your time today. I'll open it up for questions, and feel free to email me with any questions about this and moving forward. Thank you.